Their deaths by suicide have taken many by shock. It's also brought attention to the disturbing statistics on mental health in India. The WHO says India has among the largest populations with mental illnesses, yet stigma, denial and lack of policy focus define our response. Why are residents of popular holiday destinations asking tourists to stay away? And cricket-crazy India may not have qualified for the FIFA World Cup that gets underway in Russia today, but we are making up the numbers in the stands. Among countries whose teams did not qualify, Indians have bought the third highest number of tickets on sale. It's Thursday, June 14th. The last few weeks have brought multiple reports of death by suicide of high-profile public figures. In America, the conversation among mental health experts after celebrity chef Anthony Bourdain took his own life centers around concerns of suicide contagion. Concerns of how extensive news coverage might impact others struggling with thoughts of suicide. Here in India, where spends on public healthcare itself have been pitifully low, never mind the promised world's largest healthcare program announced in the last budget, mental health barely makes it to the table of public discourse. Here is why that must change. According to the World Health Organization, India has one of the largest populations with mental illnesses and are the worst hit with depression. WHO estimates 36% of all Indians suffer from depression. Young Indians between the age of 15 and 29 make up the world's largest number of suicides. Acknowledging that India is staring at a mental health epidemic, President Ramnath Kovind said the biggest obstacle that mental health patients face is encountering stigma and denial.
The number of Indians suffering from a mental health problem is larger than the entire population of Japan. We need to talk about mental health issues and treat ailments such as depression and stress as diseases that can be cured, not as guilty secrets to be pushed under the carpet.
Citing figures from the National Mental Health Survey of 2016, President Kovind said around 14% of people in the country require mental health interventions and about 2% suffer from severe mental disorders. The challenge, he admitted, was that there is a severe shortage of professional help. There are only about 5,000 psychiatrists and less than 2,000 clinical psychologists in India. Until recently, attempting suicide was a criminal offense. If people tried to end their lives and survived, they could be prosecuted under the IPC, jailed and fined. That has now changed after the law decriminalizing suicide was notified earlier this month. An India Spend report earlier this year analyzing healthcare spending underscores the near irrelevance of mental health for policymakers. Allocation to the National Programme for Mental Health has been stagnant for the past 3 years. At 35 crore rupees, the program received 0.07% of India's 2017-18 health budget. The budget allocation for 2018 for the National Mental Health Programme saw an insignificant increase of 15 crore rupees. Let's look at a comparison. India spends up to 0.06% of its health budget on mental health care. This is less than Bangladesh. Most developed nations spend above 4% of their budgets on mental health research, infrastructure, frameworks and talent pool. This is despite the fact that an estimated 10 to 20 million Indians suffer from severe mental disorders such as schizophrenia and bipolar disorder. Nearly 50 million, almost equal to the population of South Africa, suffer from common mental disorders such as depression and anxiety. What about medical insurance for mental illnesses, you would ask? The new Mental Health Care Act states that every insurer shall make provisions for medical insurance for treatment of mental illness on the same basis as is available for treatment of physical illness. This provision makes it mandatory for all providers of insurance in India to have certain policies and provisions in place that also account for mental illness on par with physical illness. However, as the Health Collective points out, India currently does not have any distinct insurance coverage for mental health disorders, even though several health policies may cover mental illness briefly or under other conditions. Now, the gap between mental health needs and treatment is even wider in rural India. Recent efforts, though, like a suicide prevention program in Maharashtra's Vidarbha region involving community health workers, has reduced the prevalence of depression and suicidal tendencies in the area. These tweets from water-starved Shimla residents asking tourists to stay away from the hill town were a rude awakening. They are echoes of war, an anti-tourism campaign in Venice. Last year in Barcelona, protesters slashed tires of a bus and spray-painted across its windscreen, "Tourism kills neighborhoods." Across Spain, graffiti saying "Tourists go home" and "Why call it tourism season if we cannot shoot them" has emerged. It's clear, tourism, the $7.6 trillion global industry, is growing under duress at the cost of locals. In Bali, Indonesia, rivers are running dry. Last year, authorities excavated tons of debris from 6 kilometers of its coastline that was under a garbage emergency. Authorities are hoping that the island of 40 lakh residents will attract 70 lakh tourists this year. Maya Beach on the Thai island of Ka Phi Phi, made famous by Leonardo DiCaprio's The Beach, has been closed for 4 months. The reason? Its battered coral reefs need to recover. In Malaysia, tourism has destroyed half of Langkawi Island's rainforest and its mangroves. In Tanzania, 185 Maasai homes were burned down. 6,800 people left homeless to facilitate hunting tours. In India, indigenous residents of reserve forests are regularly evicted, leaving them homeless. Cambodia, where foreign nationals volunteer in orphanages, saw a 60% increase in the number of orphanages between 2005 and 15. 80% of the children in these orphanages, it was found, have at least one living parent. In 1996, tourists took 560 million trips abroad. In 2016, annual trips doubled to 1.2 billion. And it's clear, this T-shirt tribe, determined to enjoy, litter and let loose, is unwanted. Why? Global tourism has a huge carbon footprint, about 8% of global greenhouse gas emissions. While American tourists take the lead, contributing 1,060 metric tons. Irrespective of where they travel, Indians follow fourth after the Chinese and German tourists. Or 7-day tours through 7 countries like offers are easier on the pocket but have resulted in more tourists concentrated in the same attractions. Airbnbs have made tourism affordable but has also resulted in the rise of unlicensed properties and the further blurring of boundaries between tourists and residents. Landlords also earn more renting their properties to tourists at the cost of locals. Your comfortable stay means more resources, electricity, water, land, and more waste is generated, more use of transport and public facilities that are already under strain. These cities are groaning under the weight of their own popularity. So, solution? Florence, Barcelona, and Ibiza are imposing fines on littering, public picnicking, nudity, and noise pollution. In Bhutan, Palau, and Botswana, tourists must spend an expensive minimum in the country per day. Venice is planning to ban large ferries from entering its canals. World heritage cities like Georgetown and Malacca are encouraging citizens to join policy conversations. All the conversations center around resources. How many times do you ask that your towels be replaced? How much water do you waste? Do you leave your room lights on while on holiday? No wonder this article says that the next trend in travel is don't. India may not have the proverbial dog in the fight, but come today, we're ready to rekindle our heady yet mystifying love for football. India has never qualified to be one of the 32 teams that play in the FIFA World Cup. Technically, we did qualify by default in 1950 when all scheduled opponents withdrew but couldn't afford to go. We're still a FIFA rank 97. But we topped the charts for the number of FIFA tickets bought or matches watched on television. According to FIFA's Global Audience Report, 44.9 million Indians watched the FIFA 2010 World Cup on TV, while 85.7 million viewers, 46% more than the previous edition, tuned in to watch the Cup in 2014. This year, Indians were one of the top 10 countries to have purchased tickets in Phase 2 of the ticket sale. Among countries whose teams did not qualify, only USA, who didn't qualify for the first time since 1986, and China, who haven't managed to qualify since 2002, bought more tickets than us. We also have the super fans, Panna Lal and Chaitali Chatterjee, the Kolkata couple who have watched every World Cup live from the stands since the Spain World Cup in 1982. Now at 85 and 76, the Brazil-supporting Bengalis think this may be their last. Panna Lal will be 90 by Qatar 2022. But do these numbers add up to us cheering for our own side in the near future? Or did former FIFA President Sepp Blatter's "India, the sleeping giant of football" refer just to us waking up to being a greater market for the sport? Enjoy the games and meet us back here tomorrow.